and agitation that lasted for 2 weeks. He eventually volunteered for treatment and the petition was dropped. He had his first mental health inpatient hospitalization in November 2020. He reported persistent, elevated, irritable mood, anger outbursts, increased aggression, and increased activity that lasted for 1 week and present most of the day and every day. He presented also with increased energy and was hyperactive, reported decreased sleep. His speech was pressured, it was difficult to interrupt. He had racing thoughts and easily distracted, was a significant change from his usual behavior 6 months before this incident. And due to all the symptoms, he was hospitalized to prevent harm to others and to himself. The patient also reported that he was becoming irritable and aggressive towards the mother of his child for the past 6 months. He also reported depressed mood most of the day and nearly every day for 3 weeks. He also reported loss of interest and pleasure in almost all activities most of the day and nearly every day, poor appetite nearly every day, insomnia every day for more than 2 weeks. He reported increased hopelessness, helplessness, poor sleep, and poor appetite. He reported that his marijuana use increased from once daily to more than 3 times daily, which led to the loss of his job last year, 2020. He has been receiving psychiatric treatment from the same psychiatrist since he was 12 years old, and he states that he has had mental issues all his life. His primary caregiver is his mother. He has tried medications. He has tried the following medication: Adderall, Celexa, Seroquel, Zyprexa, Luvox, and Depakote. And his current medications are Devaprox, ER 500 milligrams POBID, Seroquel 500 milligrams PO-QHS, clonazepam 1 milligram PO-TID as needed. He also reports that he's been diagnosed with depression and started receiving treatment at the age of 12 years old. And he's currently diagnosed with bipolar disorder. Recurrent episode manic without psychotic features. He is a current day smoker. He smokes cigarettes about a pack a day. He reports that he uses marijuana occasionally. He denies alcohol, opiate, benzos, and cocaine use. He also reports that his mother has multiple psychiatric illness. He was born in New York. His parents divorced when he was 7 years old, and he's currently living with his mother and his stepfather. He's a twin, maintains good contact with his sister. He has no relationship with his biological father. He is currently going through a divorce with the mother of his only son. He wants to maintain good relationship with the mother of his son, but then he reports that there's a lot of friction and anger towards his ex-wife. He's currently unemployed, but he intends to start working with Uber. He used to work as a dispensary educator for the marijuana industry. He has a history of incarceration, and he said he used to be a gangbanger when he was young. He has no current childhood trauma and says he feels safe at home. He denies any physical, emotional, and sexual abuse. A review of all the symptoms, everything appeared normal. For psychiatric, he denies SI, HI, and AVH. He denies mood swings and depression. During his mental studies examination, he appeared his stated age. He was well-groomed and appropriately dressed. He was cooperative with the provider, maintained appropriate eye contact, though he was impulsive and restless, he was oriented to person, time, place, and situation. His gait was normal and has normal muscle strength. His speech was pressured, hard to interrupt, normal in volume and tone. His thought process was disorganized and tangential. His mood was elated and anxious, and his affect is appropriate to his mood. He denies any current suicidal ideation, homicidal ideation, auditory or visual hallucination. He was oriented to person, place, and situation. His recent and remote memory is intact. His concentration is distracted. His insight is poor. For his differential diagnosis, the first diagnosis was bipolar disorder, current episode manic without psychotic features. With the presentation, patient had 3 of these symptoms. The second one was major depressive disorder. He reported having depression, hopelessness, helplessness, and loss of interest. And then the third diagnosis was cannabis use disorder. He reported that he uses marijuana. Thank you.